Hi, after watching the video, click the link in the description to download the program.
Hi, this is Tom from ZeroToFinals.com. In this video, I'm going to be talking about vertigo and specifically trying to understand the causes of vertigo. Vertigo is a descriptive term for a sensation that there's movement between the patient and their environment. So they may describe that they're moving or that the room is moving, and often this is a horizontal spinning sensation, similar to the sensation you'd get when spinning on a swing and then abruptly stopping and the environment continues to feel like it's moving around you. Vertigo is often associated with nausea, vomiting, maybe a sweating sensation, and generally feeling unwell. So let's go through the pathophysiology of vertigo. Vertigo is caused by a mismatch between the sensory inputs that are responsible for maintaining your posture, and these inputs are vision from your eyes, proprioception from your joints, and signals from the vestibular system. The vestibular system is the most important sensory system to understand when we're learning about vertigo. The vestibular apparatus is located on the inner ear. It consists of 3 loops called the semicircular canals that are filled with a fluid called endolymph. These semicircular canals are oriented in different directions to detect different movements of the head. So as the head turns, the fluid shifts within the canals. This shift in fluid is detected by small hairs called stereocilia that are found in a section of the canals called the ampulla. This sensory input of shifting fluid is transmitted to the brain by the vestibular nerve, and it lets the brain know that the head is moving in a particular direction. So essentially, this vestibular system is important for detecting movement of the head. The vestibular nerve carries signals from the vestibular apparatus to the vestibular nucleus in the brainstem and also to the cerebellum. The vestibular nucleus then sends signals to the oculomotor, the trochlear and abducens nuclei, which are responsible for controlling eye movements, and also to the thalamus, the spinal cord, and the cerebellum. The cerebellum is responsible for coordinating movement throughout the body, so therefore the vestibular signals help the central nervous system coordinate eye movements and movements throughout the body. Vertigo can be caused by either a peripheral problem, usually affecting the vestibular system, or by a central problem, usually affecting the brainstem or the cerebellum. So first let's talk about vestibular problems. And there's a number of vestibular causes of vertigo. The 3 most common causes to be familiar with are benign paroxysmal positional vertigo, Meniere's disease, and vestibular neuronitis. First, let's talk about benign paroxysmal positional vertigo, or BPPV. This is caused by crystals of calcium carbonate, which are called otoconia, that become displaced into the semicircular canals. They may be displaced by a viral infection, head trauma, aging, or without any clear cause at all. These crystals disrupt the normal flow through the canals and therefore disrupt the function of the system. The symptoms are usually positional because movement is required to confuse the system. And when the patient becomes completely still, there's no disruption to that movement of fluid, so they're symptom-free. Therefore, the attacks of vertigo are triggered by movement, and they can last around a minute before the symptoms settle. Often symptoms occur over several weeks and then resolve, but they can reoccur weeks or months later. A special test called the Hall-Pike maneuver can be used to diagnose BPPV. Next, let's talk about Meniere's disease. And this is thought to be caused by an excessive build-up of endolymph in the semicircular canals, causing a higher pressure than normal, which disrupts the sensory signals. It causes attacks of hearing loss, tinnitus, vertigo, and a sensation of fullness in the ear. These attacks typically last several hours before they settle down, and it often occurs in middle-aged adults and is not associated with movement, so the symptoms are not positional. Patients will have spontaneous nystagmus during the attacks where their eyes flicker backwards and forwards. Over time, the patient's hearing will gradually deteriorate between attacks. Finally, let's talk about acute vestibular neuronitis, which describes inflammation of the vestibular nerve, and this is usually attributed to a viral infection. However, it can occur without any other symptoms of the viral infection. The disruption to the function of the vestibular nerve leads to a mismatch in signals to the brain, causing vertigo. Usually the history is of an acute onset vertigo that lasts for several weeks before gradually resolving. There are several other peripheral causes of nystagmus, and these are trauma to the vestibular nerve tumours, particularly acoustic neuromas, otosclerosis, hyperviscosity syndromes, and herpes zoster infection, which often occurs with facial nerve weakness and vesicles around the ear, which is known as Ramsay-Hunt syndrome. Next, let's talk about central causes of vertigo. Pathology that affects the cerebellum or the brainstem disrupts the signals from the vestibular system and causes vertigo. And the most common cause of pathology that results in a central cause of vertigo are posterior circulation infarction, which is basically a stroke in this area, tumours, multiple sclerosis, and vestibular migraine. All of the central causes of vertigo will cause a sustained, non-positional vertigo, because they aren't caused by disruption to the movement of fluid within the semicircular canals, they're caused by disruption to the interpretation of signals within the central nervous system itself. First, let's talk about posterior circulation infarction. And these patients will have a sudden onset of vertigo that may be associated with other symptoms such as ataxia, diplopia, or double vision, other cranial nerve defects, or limb weakness. Tumours in the cerebellum or the brainstem will have a gradual onset with associated symptoms of cerebellar or brainstem dysfunction. Multiple sclerosis may cause relapsing and remitting symptoms, with other features of MS such as optic neuritis or transverse myelitis. And vestibular migraine will cause symptoms that last minutes to hours, often associated with visual aura and a headache. So finally, a brief summary of the causes of vertigo. The top peripheral causes to remember are benign paroxysmal positional vertigo, Meniere's disease, and acute vestibular neuronitis. And the top central causes to remember are posterior circulation infarction, tumours in the cerebellum or brainstem, multiple sclerosis, and vestibular migraine. Thanks for watching this video. If you found it helpful, please consider giving it a thumbs up and subscribing to follow the channel and find out as more videos come out. You can also find written notes with illustrations on the Zero to Finals website at zerotofinals.com. And on the website, you can also find a podcast that can help you learn on the go, questions to test your knowledge, and the Zero to Finals books. Follow the link in the description to pick up a copy of the Zero to Finals medicine book. It contains detailed and concise notes on 10 specialties in medicine, and it's designed specifically to contain the key facts and guidelines you need to know for your medical exams, with mnemonics and Tom tips to help you learn exactly what you need to know for your exams without all the hassle. Follow the links to find out more.
Hi. After watching the video, click the link in the description to download the program.